panel behind us. My name is Michelle Trubiano. I'm with Planned Parenthood Affiliates in Missouri, and we think that it's very important that everyone is here today standing up to protect access to birth control. Of course, it's been in the news a lot lately. There's been the recent decision about the Obama administration mandating that all women have to have access to birth control, even if they work for a religious affiliated institution, and making that accommodation on Friday that the institution doesn't necessarily have to provide it, but that insurance companies do. Birth control is, simply put, is basic health care for women, and it's very important that all women have access to it. Unfortunately, there are legislators here in Missouri that want to take away that access, and so there are several people here that are going to speak today about why birth control matters to them and why it's so important that everyone stands together to fight for access to birth control. So I'm first going to turn it over to Representative Tishaura Jones.
Yeah. The short cord.
Yes.
All right. Good morning, everyone, or good afternoon. I lose my track of time on Mondays. My name is Representative Tishaura Jones. I'm the Assistant Minority Leader, and I represent the 63rd District. And I want to tell you a little story. When I just finished graduate school, I started working for a Catholic hospital, and went to get my insurance benefits, and I thought, okay, well, I can get back on birth control. And after going to the pharmacy and getting my prescription, they said, well, that'll be $10 per pack that I was getting. And I said, wait a minute, I have health insurance. What are you talking about? And they said, no, well, your health insurance plan doesn't cover birth control. So I went back and looked at the formulary and looked at, the details, the devil's in the details, and found that even though I worked at a Catholic hospital and had health insurance, it was a Catholic-sponsored insurance plan, and they covered Viagra, but they didn't cover birth control. And I thought that was really hypocritical at the time, but I needed access to birth control, so I was one of those people that had health insurance but still had to buy birth control. And I really want to applaud the administration for making access to birth control universal, because a woman should have the right to plan and space her children. A woman should have the right to say, my career comes first, or whatever in my life comes first, and I don't want to have children at this time. And for others to say that this is a religious attack is bogus. This is about access. This is about a woman's right to say I do or don't want to have a child. This is about a woman's right to have access to birth control. And for Catholic institutions to think that this is a war on religion is also bogus. So again, I applaud the administration for making sure that women have access to birth control. And at this point, I'll turn it back over to Michelle. Thank you.
So just as a point of clarifications, we will be answering questions after everyone is done. So next I want to turn it over to Bailey Parish, who works at a Catholic hospital, and so she's going to talk about how this federal mandate affects her.
My name is Bailey Parish. I'm a 23-year-old employee of a Catholic hospital. I grew up in Ozark, Missouri, and moved to the city of Springfield when I was 18 to study psychology, biomedical science, and religious studies at MSU. When I was 20, I was hired on as a nurse's aide. It's often hard, unglamorous, and underpaid work, but together with nurses, doctors, social workers, housekeeping, and administration, we take care of our patients. We take care of each other. I will continue to work with what has become my family until I move to Washington, D.C. in the fall to study public health promotion. It will be a happy move because my education will allow me to reach more people, but will be sad because I will be leaving the mothers, grannies, sisters, and brothers that have changed me for the better. The Obama administration in the city that I will soon call my home recently made a decision under pressure to protect affordable access to birth control. Now millions of women, including those in my surrogate family, who are employed at religiously affiliated hospitals or universities, will receive the same health and economic benefits as everyone else. These are benefits we need. When I first started, I didn't care about being an active contributor to the system or being a better person. I needed a job. But like any good first job, my experiences there have taught me the value of discipline, the power of a positive attitude, and most importantly, love and tolerance for others despite personal differences. When I'm on the clock, I understand that I am not there to form opinions about people. I am not there to inform others. I may not refuse to provide a service that medical science has proved to help others because of how it makes me feel, or how I feel about the one giving me the order, or sometimes even what I know to be true. Because, although ministry is a valuable ideal, the organization I work for is primarily focused on providing medical care for all who need it by employing all who are capable of providing it. That is all that this provision, which has received so much media attention, is trying to do: provide care. By making birth control available and affordable for all, it gives women and families choices. Others would have you believe that this provision tramples on the religious choices of institutions. What they fail to mention is that the original compromise on this policy gave churches and houses of worship the freedom to opt out. Approximately 335,000 are exempted. And on Friday, President Obama went even further, making special accommodations for religious employers like mine, who operate like any other employer in terms of employees and people served. These include huge hospitals and universities, which have a primarily secular purpose and hire thousands of people based on secular criteria. The new policy says religious institutions will be allowed not to cover contraceptive coverage should they choose. Importantly, though, the President clarified that the insurance companies will offer contraceptive coverage to those employees with no additional burden or cost. If you have been told differently, that person was either misinformed or not telling the truth. America has the value of religious freedom because it values personal freedom, not the other way around. Employers must also respect personal freedom, and that is something conservatives and progressives can agree upon. In 23 years, I have learned that people will always disagree, but when we make policy decisions, we have to pay careful attention to the facts. Women of all faiths, even Catholics, use birth control. They do so in the same proportion as all other women. Birth control allows women to plan their families and have healthier pregnancies. This means more healthy mothers and children, and a majority of the American public supports this new policy. Sometimes on our own quest to serve God, we see only potential threats to His world. We forget that He is about tolerance and choices too. This provision will not force anyone with objection to consume or provide birth control. It only makes it affordable for those who choose it and are responsible enough to possess health insurance.
Thank you, Bailey. Next up, we have Representative Chris Kelly, who is a practicing Catholic and also a fiery legislator, and so I'll let him speak to you.
In theory, I'll get it right if I practice. When I was young, junior in high school, in Catholic high school, I came home angry at something the church had done, telling my father that that's it, I'm never going to Mass again, and why, and he said, yes, you're right, they shouldn't do that. And then he taught me to distinguish between the corporate church and the community of believers. The Archdiocese of New York has owned, or did own in the 30s and 40s, lots and lots of slums. Should it be that the church, when it's operating as a corporate entity, should be free from the law regulating housing if they run housing? Because they have some religious objection. Should Jehovah's Witnesses be allowed, if they have a health care plan, be able to take blood transfusions because they don't believe in blood transfusions? It's real important to separate the concept of the religious institution, the community of believers, from the corporate entity. When a church, including my church, is behaving as a business, it ought to comply with the law having to do with a reasonable regulation, the legal regulation of that particular business. I think that's an easy principle to understand, or else we could all hide in religious exemptions. For example, it may be immoral for a woman to conceive a child out of wedlock. Should it be that she's not entitled to prenatal care under the insurance plan because she conceived the child in a way that the religious institution deems immoral? I don't think so, and I don't think that the majority of Americans think so, and I don't think the majority of Catholics think so. I believe that the institution, when acting as a church, is free to have any point of view that it wants to have. But when it crosses the line into the business world, as an insurance company or a hospital, it ought to comply with the rules governing the hospital. It could not, for instance, decide to have its own rules with regard to cleanliness, could it? And a whole lot of other standards. So, please separate the church as a community of believers from the corporate church. Thank you very much for your
Thank you, Representative. Next up, we have Senator Justus, who unfortunately is going to have to fight 2 bills in the Senate that are trying to roll back the benefits of this federal mandate, even with Obama administration's clarification and accommodation on Friday.
Thanks. My name is Jolie Justus. I'm a state senator for Kansas City and Grandview. I'm here to say today that birth control does matter. Unfortunately, in the Missouri State Senate, when we should be talking about things like jobs and education and moving Missouri forward, we are once again fighting a culture war that is only harming women. Birth control matters for a couple of reasons. First of all, birth control not only prevents unintended pregnancies, but it also is helpful in the management of several women's health diseases. It's something that women use on a regular basis and should have access to help manage their own health care. It is preventative, it is necessary, it matters. Additionally, it matters from a financial standpoint. If you want to talk about bottom line and saving money, think about this. Federal Medicaid dollars, for every dollar that is spent on birth control, the federal government saves $3.74 in Medicaid funds. So for every dollar spent, we're saving $3.74 in Medicaid. It matters, it makes sense. But unfortunately, in the Missouri Senate at least, we've got 2 bills that have been filed that are going to try to roll back the advances that we've made in making access to affordable birth control to all women in the state. One of them is Senate Bill 749, which will be heard in committee tomorrow. I hope that many people in the state are able to make it to Jefferson City and let their voice be heard on why this is a bad bill. It doesn't just stop at religious institutions either. It says that any CEO or any person who runs any health care plan, if they have any problem with birth control, that they're able to roll back those benefits for the women that support them. We need your help in this war on women. Birth control does matter. It's a health reason that we need it. It's a financial reason that we need it. And I hope that you come down and help us support women in the state.
Thank you, Senator, and thank you for always standing up as the last woman fighting on the floor. Next is Chimene Schwach from Columbia, who is also a practicing Catholic, and just want to, the reason we're having so many Catholics are speaking is to show that that the bishops do not actually speak for the general public who are practicing Catholics.
Good afternoon. My name is Chimene Schwach, and I am a married Catholic woman. I have 2 children. My boys are here with me today because it's a snow day. And I'm also the co-chair for the Parents Association for my son's school. So I think I am a good representative of the average mom. I have a busy life, and let's talk about, I want to talk about what Catholic women want, because I think it's the same thing that non-Catholic women want. The bishops don't really represent us all the time. The Catholic Church teaches us individual consciousness. And when I was growing up, I grew up in the era of social justice. And it was really inculcated in me that we are responsible for our brothers and sisters on the planet. And that means assisting with health care and prevention. And as a Catholic woman, I am not any different from any other woman in the country. 98% of sexually experienced Catholic women have used birth control at some point. And if you come to Mass with me, and I go to Mass regularly, at our Mass we go to 11 o'clock Mass, and there are not very many families with more than 2 or 3 children sitting in the pews next to me. And so you can kind of infer from that what you will. We care as women, we care that we already have children to take care of. We want, birth control matters because we don't want unintended pregnancies. And as a Catholic woman, we want to reduce the number of abortions. And even before all of these additional accommodations were made on Friday, 58% of Catholics believe that employers should be required to offer and cover contraception within their health insurance plans. And that's important to me. It's important to my family. We don't see it as we don't see birth control as a political issue. We see it as a health issue. And birth control allows women to live healthier, longer lives and to take care of our families, which in turn helps us to take care of men, so this is not really just a woman's issue. It's by extension everybody's issue. So, thank you.
Thank you, Chimene. And last but certainly not least is Representative Jill Schupp.
Thank you, Michelle. Good afternoon. Thanks for being here today. We really appreciate it. We know that birth control opponents are ignoring the religious freedom of individual workers. I too am a woman of faith. My faith is the Jewish faith. I think it's very important that people respect my rights to these accommodations and all people's rights to these accommodations. No one is forcing a woman to use birth control. We're just making it accessible and available for that woman and her family to make good decisions about how they go forward in their life. It's an important day here, and it's an important discussion that we're having. Let's not go backwards and cut off women's accessibility to health care through these important changes in our legislation. Let's make sure that going forward that we're able to take care of women and each other, and even men. Even men are a part of this, to make sure that birth control is available for those who choose to use it, and those who choose to use it can get it without copay. Today is a very special day, and I'm here because I really believe in this purpose. I stand with Planned Parenthood. I think we all stand with Planned Parenthood. Thank you.
Thank you, and with that, that wraps up the press conference.